And so I guess while we're waiting for some questions to come in, um, uh, I would love to hear more about your work, particularly as a student advocate. Myself, it's so exciting to see how you're engaging students in the planning process of this. And I'm wondering if there have been any considerations on how this process itself can improve student health. Sorry, I just got a notification that my internet connection's unstable. So if I freeze, please let me know. So since social prescribing is all about the principles of health promotion, where self-confidence and self-efficacy are some of the key outcomes, are we going to see if the process of implementing social prescribing itself can be uh, supportive of student well-being at all?
Thanks, Le-Tien. Okay, so I can take a little stab at that. So when we were thinking about how to set up the study, this case study at U of T, we were thinking about what would be necessary to involve and who we would be needed to involve to ensure that if we're looking at a pathway, if we're looking at building a model, who needs to be part of those conversations? So students are the ones that the services are built for, and in order for them to find the services or resources or initiatives meaningful, they need to take part in ensuring that their perspectives and voices are integrated in the building of the pathway and services. Student perspectives are hugely important for our understanding on not just what is available, but how they're being uptaken and how they're used or not used. Because there's one thing to say that campuses or post-secondary or college settings have an array of initiatives and services. They're microcosms of different things that are available, but how are students utilizing this? Are they even utilizing this? And how would they like to see themselves in the driver's seat of their healthcare journey? And so I guess particularly looking at how working alongside students, undergraduate, graduate, international students within the advisory capacity of building the study in itself, of then working to collaborate with administrators, with the health centers at the 3 campuses to give their insights and feedback would be extremely valuable. And I'm hoping, and I mean, I'm not quite sure, but I'm hoping that in being part of that journey, students themselves are advocates for their own health and well-being and also their peers. I am currently embedded at jack.org, and we've seen that student advocacy is extremely important in system change. Jack chapters are across campuses, and students have advocated with their campuses and with their administrators for what they think is important to them and how they would like to see these services. And I think perhaps that could be one way.
Thank you so much, Nicole. I think it's really exciting to see how central student voices are in this process. So I see a question here from Devin. I'll just read out the comment for you. So I'm sorry if I missed this when Nicole was talking about the case study, but I'm curious about who you see playing the role of the link worker. Is this built into existing roles such as advisors, instructors, and peers, or are you creating new roles?
That's a great question. It's actually part of our objectives to understand what existing infrastructures are available. We know that our healthcare systems, including campus systems, are very much at a point where we're at capacity, strained. And so I think to make this something that could be sustainable, that could be integrated, we're trying to see what could be available at these different contexts or health centers. They all might differ in how they approach student mental health and wellness. A student may walk in to a welcome desk and be greeted. And from there, we want to know what happens, who's available, what kinds of programs and initiatives are available, and how we can use some of the roles that may be existing. Maybe there are navigators in health centers. Maybe there are peer-to-peer models already in place. How we can leverage some of the existing ways in which campus different health centers are utilizing their I guess work resources or infrastructure, and how that could be leveraged into harnessing that role of the link worker or navigator. We saw from the theoretical model that peer-to-peer seems to be something that's highly advocated for in this role. But we want to see how relevant that could be within the context and how that could be supported with the infrastructures available. So to answer your question, Devin, we don't quite know, and that's what we're hoping to find out in looking at the feasibility study.
Amazing. And Dan, I was wondering if you had any insight on that in the UK context, in schools, even if it's not universities, who is the link worker in those pathways?
Yeah, so in the schools and CAMS, so child and adolescent mental health services work that we've been doing, there are already link workers within the system. So they're a specified role as opposed to building it into something else. That's not to say that it can't be. I think the critical consideration with regards to that is social prescribers have two key functions that I think differ from other roles. One is a good understanding of the social determinants of health, and the other is a really good understanding of the local community and the things within that. So I think there just needs to be a consideration that if it is implemented by another individual, making sure that there's sufficient time carved out to be able for them to be able to fulfill those functions is critical.
Amazing. Thank you so much. We have another question here from Jennifer. I'd imagine some pushback from campus admin, staff, faculty would be regarding, sorry, I've lost it, would be regarding how much of a heavy lift this would involve, such as the cost to operationalize. What would you suggest are the key points to build your business case?
So that's a really great question. Administrators, student health and wellness services are already quite stacked to their max with the ask of them. Part of the feasibility study is trying to look at what would be, I guess, available in terms of what they're already doing. We know that there might be multiple initiatives. Each campus may have its own initiatives and programs. We're trying to see how that pathway is being built, if there is a way of streamlining that pathway. Also looking at measurement-based care and looking at the kind of data that's being collected to know how referrals are made, how students are followed up, if they're followed up with, to understand all those different steps involved before an actual implementation or piloting of this could be available. I think a large piece that we've seen is the extension beyond the health center into the community, and how that intersectoral collaboration can be harnessed and made. For a lot of campuses that aren't residential campuses, that are commuter campuses, students are traveling from the community surrounding that campus. And so engaging with the social and community sector would be a really important step in seeing the feasibility of what those partnerships could look like, in ensuring that there are meaningful ways. Of course, there is a huge financial ask. And so right now we're just trying to see if this is even something feasible to look at within some of the strategic plans and budgetary allocations that are already made on campus.
Just building
Great.
on that a tiny bit from our rollout and piloting of social prescribing in schools, we anticipated similar issues. None of them actually came to fruition. Like it was actually very low burden from other members of staff if there was a link worker in place. And it actually saved some of the staff time because they would be seeing these students for mental health and wellbeing support anyway. So it's just thinking, at least from a school perspective, how it fitted into the system, and overall it's gone down well.
Amazing. Our next question comes from Ryan, who thanks you both for your presentations. My question is about stigma. How will you navigate the diverse stigmas that exist among different student groups around the services in social prescribing? Lots of different backgrounds come with their own views of mental health, which your student advisor groups might highlight in your consultation. Is there a pre-step you might need to tackle before the actual option of social prescribing offering can be uptaken more efficiently with the various student groups you hope to reach?
Dan, I don't know if you want to tackle this first, but I can give some insight. I completely agree, Ryan. Our understanding of what mental health means is shaped by our lived experiences. And I think that's an essential step to understand what matters to young people. And so the idea with social prescribing is to change that initial interaction. Usually when a student enters a health and wellness center or seeks information online, a first interaction is, what's the matter with you? What brings you here? What are your problems? We're trying to see how we can address this by changing that interaction with what matters to you. What are things that makes you thrive that you aren't doing? What are things that would scaffold your well-being? And that may have very different conversations about what we consider mental health and mental wellness, moving away from a Western model of mental wellness and health, and really integrating cultural models. Previous work that I have done with different populations, with Black youth, with Indigenous youth, show that there are very different conceptualizations of mental health and wellness. And what that means for different groups would vary. And I think then the ask is, how can campuses or post-secondary or higher education settings represent these needs in ways that are recognizable and accessible to students? Not just like you enter a health and wellness center, you wait to see a health professional, and there is a very standard process. How can we open the doors for other modes of understanding and being that's related to our wellness?
I think Nicole's answered that brilliantly. I would only just add that I see social prescribing very much as an assertive outreach type approach. You should go to where people are, not have them necessarily come to you. So if it's going to be, it could be based in faith centers, in cafes. Like it's very much breaking down those stigma barriers. But once you're there, the strengths-based approach, which Nicole has highlighted very eloquently, is one of the keys.
And I guess to build on that, Dan, we've seen it's some evidence related to art prescribing or nature prescribing or health prescribing, where it actually does take that setting to the student. And so art hives on campuses, engaging in sports teams, like we're thinking about mental health in very different ways in terms of what's meaningful to the student.
Amazing. I think we have time for one more question. So Zelda asks, orientation and Frosh Week would be an example of old school traditional social prescribing. However, post-COVID, the role of this undertaking has drifted, especially as the student leader succession has evolved and experienced a max exodus, and the incoming students have no role model around this major activity. How might this traditional social prescribing endeavor be taken into account in this U of T project?
Yeah, that's a really great question. And I don't have specific answers. As you pointed out, Zelda, there are pivotal points that students may have insight on how they can take care of themselves and help their journeys. Frosh Week is one of them, orientation, during exam periods, there are often initiatives on campus that promote health promotion and well-being. I think working closely with the young people on our advisory to have them indicate ways in which we could basically move away from the traditional sector of providing services to ways that are meaningful for them. I've seen different spaces become utilized, cafes on campus, libraries, a room in certain spaces like a library where it's open for drop-ins, where information is available about mental health literacy and well-being. I think this would be a valuable start. I don't know, Dan, if you have any insight on what that could look like, what that's looked like for the work that you've been doing in the UK with students younger or in higher education settings.
I'm not sure I do at the moment. I'm sorry.
Oh, that's totally fine. I think we're just about up on time anyway, so I'd like to thank the audience for their amazing questions, and I'll pass it off to Kirsten.
Thank you, everyone. I just thought I would mention 2 events that we have coming up. One is the 2025 Inlight Annual Research Symposium. It'll be held at the University of Toronto Faculty Club at the downtown campus on February 27th, where we will explore holistic approaches to student mental health and well-being. We are also hosting an event called Global Campus, a global collaboration to advance well-being in post-secondary summit. This consensus building event will take place immediately following a very large international conference called IAYMH, International Association of Youth Mental Health, that's taking place in Vancouver. Just after that event, we are hosting an event to bring together students, staff, and faculty from around the world to discuss specifically post-secondary student mental health. The registration for both are free. So if you're in Toronto on the 27th, please join us. If you're going to be in Vancouver on the 21st and the 22nd, please do join us. Again, they're free and we will ensure that food is available. Also, please subscribe to our e-bulletin at Inlight, where we send out a number of these wonderful events. So learning about this partnership can be found at our website, which is linked in the chat box. Please complete the feedback form that was linked, not just for us at hosting, but also I always mention to our speakers who are looking to move into a tenure stream or a research intensive role, that the feedback from these events and the attendance at these events is really helpful for formulating their packages for those positions or for promotion. So please do complete them. So thank you again to Nicole and Daniel and to Le-Tien for hosting, and we will send out information through our network about the next speaker series. Thanks, everyone.